This is my injury prevention plan for suicide. Some background information on suicide. Suicide is a major cause of death in the United States and an important public health issue. Unfortunately, this public health issue does not have enough awareness brought to its attention. This is partly due to the existing taboo and stigma surrounding suicide and mental health issues. Suicide and suicide attempts not only impact the person who is attempting suicide, but it also impacts the health and welfare of families, loved ones, friends, colleagues, and communities. As of 2019, the age-adjusted rate for suicides in the United States was 13.93 per 100,000 people. One population that is affected most by suicide are men. Men are more than 3 times as likely to commit suicide when compared to women. Another population that is impacted more by suicide are people living in rural and non-metro areas. Note that in the table of the United States, Alaska and Montana are darker compared to New York and California. This is because Alaska and Montana are states that are more secluded and rural. The average cost of one suicide is over $1.3 million, with the total cost of suicides and suicide attempts being $93.5 billion in the United States alone. A key intervention that was already tried for trying to combat suicide in males was where they examined workplace interventions in industries that are more male-dominated. In this intervention, there was a focus on improving mental health literacy and education. The result of the intervention found that these men were able to grow their social support network. Another intervention that was used to address suicide in males was a school-based education intervention that promoted mental health in boys. The aspects of the mental health intervention were specifically dialed into focusing on suicide prevention and health promotion. This intervention found that education that was given to the boys in the study increased their help-seeking behavior and thus was able to help identify more people at risk. My proposed intervention. One intervention that I think would have great benefits for preventing suicide in men would be a men's stress workshop. Men are less likely to attend therapy or use other mental health treatments due to traditional gender roles stigmas. By using a workshop, men would be more likely to come since it would look like another class for men to better themselves. The workshop would be set up as a class focused on educating the participants about stress managing tools. One aim of this workshop would be for the participants to increase their social support network by meeting others in the class that are going through similar things in their lives. Another aim would be to provide men with skills in cognitive behavioral treatments. This type of treatment helps the person to become aware of negative or inaccurate thoughts and thinking patterns so that they can recognize it and learn how to respond to these thoughts in a helpful way. When teaching about cognitive behavioral treatments, the intervention will also educate the participants on the stigmas surrounding mental health and traditional male gender roles. Being able to reduce these stigmas will tremendously help prevent suicide in men, since men tend to look at depression and sadness as a feminine issue, but it's not, it's human. Using this workshop as an intervention will allow for men to see that other men have similar issues to themselves. Being surrounded by other men who are going through similar issues will be helpful, especially when it comes to reducing the stigmas. So in summary, this men's stress workshop will educate men with tools for managing stress, provide them with a safe space to talk about stress and their emotions. And my hypothesis is that this intervention will decrease the severity of their depression and reduce the likelihood of them committing suicide.